So those are the three parts of the brainstem. But I want just to show you this now. Let me just show you a nice brainstem so that you can be able to appreciate it. Now, from this diagram, are you able to see this diagram with vessels, blood supply?
Yes.
Now, this is the part that we call actually the medulla oblongata. This part, it is what you call the medulla oblongata. Then the middle part here, the middle part here, it is what you call the pons. It is what you call the pons. The uppermost part here, this one, it is what you call the midbrain. So this brainstem actually contains three parts. Number one, we have the midbrain. This is what we call the midbrain. Number two, we have this what you call what? The pons. Then lastly, we have this what you call the medulla oblongata. So those are the three parts of the brainstem. Now let's go back to the first slide. Now, the overview now, introduction includes medulla oblongata. We have talked about the medulla oblongata, the pons, and the midbrain. Now, extend from pyramidal dissection to posterior mesura. Now, what you call this the cassation? The cassation, this is when the pentacles, now they're moving to opposite direction. It is what we call the cassation. We'll talk more about it later. Then it gives rise to the cranial nerves. Now, this brainstem, it actually give rise to the cranial nerve. That is cranial nerve from cranial nerve number 3 to cranial nerve number 12. So we have the cranial nerve from number 3 to cranial nerve number 12. They actually originate from the brainstem. Now, it receives blood supply from vertebrovascular system. Now, this vertebrovascular system, it's actually one of the major arteries that supplies the brain. Then contains the reticular formation as its central core. Then you have phylogenetically old function. We have talked about it during our last lecture, which co-integrates of the central nervous system as it receives collaterals from most afferent and efferent system. We are going to talk more about efferent and efferent system when we will be looking at the CNS, now the nerves. Now, let us look at the overview of medulla oblongata. Now, the medulla oblongata contains autonomic centers that actually now regulates the respiratory system. It also regulates the circulatory system and gastrointestinal motility. So medulla oblongata, you're able to see it actually regulates these three systems. Number one, respiratory system. Number two, circulatory system. Then lastly, intestinal system or motility. Then extend from pyramidal decussation to inferior pontine sulcus, give rise to cranial nerve number 5 to number 11. The nuclei of number 5, number 7 extend gradually into medulla, then extended to cerebellum, the inferior cerebellar pentacles. Now, we want to look at the external structures of these medulla oblongata. Number one, the region between anterolateral and posterolateral sulcus, you are able to see the marks of olivary bodies. These are called olivars. Now, these olivary bodies, you're able to see them at the anterolateral and posterolateral sulcus. You're able to see this body. Then they have the largest nuclei of olivary bodies and also inferior olivary nucleus. Then posterior part of medulla oblongata, now between the medial sulcus and the posterior sulcus, contain tracts that enter the posterior funicules, which you can find in the spinal cord. Then also we have the gracilis follicles. You're able to see them. These are some of the structures. Cuneiform fossils. Then lastly, you're able to see the gray matter and the white matter and the nucleus. So these are some of the structures you are able to see at the outer cortex or external structures within medulla oblongata. oblongata. Now, ventral surface. Ventral surface. Medulla oblongata, ventral, the upper part of the medulla is deeply grooved in the midline with a bold convexity on either side and pyramid due to contain corticospinal fibers. Then we also have lateral to pyramidal is another convexity where we have the oliva due to underlying inferior oliva nucleus. As you're able to see, these are the nucleus that we're talking about. Then the lateral to olive, the lateral surface of the is formed by pentacles. This is what you call the pentacles, these things that are rising like this. You're able to see we have the three pentacles. This is what you call the pentacles. Inferior cerebellar pentacles, which enters the cerebellar median and below the medial pentacles. So these are what actually call the pentacles. Now, dorsal surface, this is anterior surface. The anterior surface, you're also able to see medulla oblongata. It has some structures. You're able to see the pentacles. These are what we call the pentacles, and also the spaces between the pentacles, the infolding. Now, dorsally, the lower part of the floor of the fourth ventricle forms the upper part of the medulla. Here, the roof of the ventricle is epiderma and pia mater. Then at the lower corner of the diamond, what we call the trigone, is adjacent to midline with vertical trigone. Then secondly, lateral to it, we are able to see the high diamond is vestibular area and medullary striae. So those are some structures you're able to see. Then you have the gracilia and the tubercles. This is what we call the tubercles. These foldings, what we call the tubercles. Now, gross part of medulla, we have something that we call the gray matter and the white matter. Now, the gray matter, it has spinal nucleus of the nerves, vagus nerve. Then we also have the spinal accessory nucleus of what? The spinal accessory nerve. Then you have the nucleus gracilis and the nucleus cuneatum. So these are some of the nucleus and the nerves you are able to see within the gray matter. Then the white matter, we have motor and sensory. When you talk about the motor, or when you're talking about the motor and sensory, it is what you take information from the peripheral nervous system to the central nervous system for interpretation. Then after interpretation in the central nervous system, the motor nervous system now takes the interpretation back to the body to be acted upon. Let me repeat myself. We have the white matter, it has sensory and the motor. The sensory nervous system, it takes the information from the body to the brain, that is white matter. Then, after taking this information to the brain for interpretation, now the brain does the work of interpretation. After being interpreted, now the action is being carried out by the motor. Now, motor nervous system. I think that is well understood, class. Is that well understood?
Yes.
Yes.
Okay. Now, we want to look at the blood supply of the brainstem. The brainstem is being supplied by this artery that you call anterior spinal artery. Anterior spinal artery is the one that actually now supplies the medial part of the medulla oblongata. Then secondly, we also have this artery that you call posterior inferior cerebellar artery. Now, this is a major artery branch of the vertebral artery that supply the posterolateral part of medulla, where the main sensory duct run and synapses. It also supplies the part of cerebellum and direct branches of vertebral artery. The vertebral artery supply an area between the two main arteries in solitary nucleus and the sensory nucleus and fibers. So we have these two artery, anterior spinal artery and posterior inferior cerebral artery. Cranial nodes. Now, the tumor of the posterior cranial fossa produce increased intracranial pressure. Now, when there is a tumor, there's always increased intracranial pressure within the brain and in tendency to downward hernia of the medulla and cerebral tonsil through the foramen magnum. Then they will produce headache, neck stiffness, and paralysis of four cranial nerves owing to traction. Then in this condition, lumbar puncture is contraindicated. When you talk about lumbar puncture, this is what you call cerebrospinal fluid. Have you ever heard of cerebrospinal fluid?
Yes. Yes.
Yes. This cerebrospinal fluid, you are able to tap it. We normally say go and tap the cerebrospinal fluid from the patient. Now, you go to the vertebral, the 4L4, between the L4 and L5, L4, what you call the lumbar number 4 and the lumbar vertebral 3. Now, in between it, you just take a syringe in between it and you'll be able to tap what you call the cerebrospinal fluid, what you call the CSF. Now, this CSF can also be used in diagnosis. But when there's increased intracranial pressure, it is contraindicated to do what? Lumbar puncture. Is that okay, class? Is that okay?
Excuse me, sir.
Yes.
What does it mean by contraindicated?
Okay, in layman's language, I can just say you should not do this. Is that understood?
Yes, understood.
Contraindicated, meaning you are not supposed to do it. Is that okay?
Yes.
Now, when there's an increase in intracranial pressure within the brain, now you are contraindicated from now taking the sample CSF for diagnosis because there's increased intracranial pressure within the brain. Is that okay?
Yes.
Okay.
Excuse me, sir.
Yes.
My question is, so if the lumbar puncture is contraindicated, how can we collect the CSF in other way that is not the lumbar puncture?
So what happens when it's contraindicated doesn't mean that diagnosis can only come from where? From the CSF, cerebrospinal fluid. Maybe the patient is having other condition. For example, the patient is having, yes, there's a tumor, but by you taking the CSF will not actually show you if there's a tumor, but CSF will show you if there's infection. So if there's a tumor, how you can diagnose now there's a tumor? You just take something that you call CT scan or MRI. So these are just some of scans, like for example, it's more advanced like the X-ray. So you'll request maybe for a CT scan or MRI. These are just a picture that will show how the brain is, if there's a tumor or any something else. But if there's severe infection, you can also take a blood sample to see if there's infection. So you are not just restricted by just taking the CSF only. So we have other things that we're able to do despite this intracranial pressure increase within the brain. Is that well understood?
Yes.
Okay, that's great. Let's continue. Now we have lateral medullary syndrome. or Wellsberg results from thrombosis. So those are the three parts of the brainstem. But I want just to show you this now is the posterior one. Just show you a nice when we have now brainstem so that you can able to. Then we have medial medullary syndrome due to thrombosis of medullary branches. Now, from this diagram, are you able to see this diagram with vessels by the thrombosis supply? Now, let us look at the pons. Now, the pons this is the middle part of brainstem. Now, the pons is located between medulla and the midbrain. The pons is located between the medulla and the midbrain. The corticospinal tract are more diffuse in pons. The medial meniscus is still situated near the midline. Then spinothalamic tract and descending hypothalamic fibers continue to course together in a lateral pons. Then you have something that we call lateral meniscus. This is now an ascending arbitrary pathway. Then it's a lateral and dorsal to the medial meniscus. Now this one, it carries a bulk of ascending auditory fibers. Now it just carries the fibers which actually from both cochlear nuclei to the inferior colliculus midbrain. Then lastly, we have the medial longitudinal fasciculus. It's located near the midbrain beneath the fourth ventricle. Now, from this diagram, you are able to see this what you're talking about, the pons. Now, these structures you are able to see, are you able to see these structures here?
Yes.
Class, are you able to see these structures arising from medulla oblongata?
Yes.
Yes.
Now,
Yes.
these are now the nerves, what you call the cranial nerves. You have 12 cranial nerves that actually originate from this brainstem. So some of them are able to see they originate from medulla oblongata. What are these originating from? Medulla oblongata. For example, here we have the vagus nerve, we have the accessory nerve, we have the hypoglossal nerve. Now remember, you're able to see these, they arise from this, what you call the unfolding, these unfolding between the pentacles. Are you able to see the pentacles? This is what you call the pentacles. Are you able to see the pentacles, these ones?
Yeah, we do.
Yes.
Now, in between them, there's a depression. Are you able to see the depression? Or the
Yes.
foldings? Now,
Yes.
that's where these nerves originate from both left and right. From the left, you're able to see here, and from your right, you're able to see where they arise from. Now, in the middle here, this is what we call the pons. The pons is between the medulla oblongata and the midbrain. So you're also able to see we have the pentacles within these pons. And actually, you're able now to see the now what happens here. Now, the nerve supply, actually the nerve now arise from the inferior surface of the pons. Are you able to see where they arise from?
Yes.
Yes, that's where they arise from. Now, this is what we call the midbrain. Now, don't confuse the midbrain and the brainstem. The brainstem, it is the old thing. The brainstem, it is the old thing. The midbrain, we're only talking at this part, the superiormost part, this part. This is what you call the midbrain. The midbrain also you're able to see it as some origin of what? The nerves. We have the optic nerve, oculomotor nerve, trochlear nerve. We have cerebellar pentacles, mammary bodies, optic tract, and optic chiasm. So these are some of the structures that actually originate from the midbrain. So I've said, don't confuse the midbrain and the brainstem. So this is just a picture to elaborate more, to show you more about what we've been talking about. Now, blood supply to the pons. Blood supply to the pons is being supplied by ciliary artery. Contribute of this main artery can be further subdivided into paramedial branches to medial portal region. Then shortcuts circumferential branches supply anterolateral pons. Then long circumferential branches can laterally over the anterior surface of the pons. So we have this artery that called the basilar artery that actually now supplies the pons. Then this just a blood supply to the brain, but we're going to discuss it further. Now, the midbrain. Now, the last bit part of the brainstem, what you call the midbrain, the superiormost part. The midbrain measures about 0.8 inches, that is 2 centimeters length, and connect the pons and cerebellum. So it's actually the one that connects the pons and the cerebellum with the forebrain. Then its long axis incline anteriorly, and it ascends through opening into tentorium cerebelli. We have a structure that actually covers the brains. When we'll be talking about the head and neck, we'll talk about the tentorium cerebelli. It actually covers the brain. The midbrain is transverse by narrow channel, cerebral adequate, which fill with cerebrospinal fluid. So we have talked about the cerebrospinal fluid, and we'll talk about it more. Now, anterior aspect of this, what we call the midbrain, on the anterior aspect of the midbrain, there is a deep depression in the midline. You're able to see it here. We call interpendicular fossa. This is what we call the interpendicular fossa, which is bound by either side by the crus cerebri. Bound by either side by the crus cerebri. Then many small blood vessels perform to hold the flow of the interpendicular fossa, and this region is termed as posterior perforated substances. Now, oculomotor nerve, nerve number 3, from a groove of medial side of the crus cerebri passes toward the lateral side of the cavernosa sinus here. So we're able now to see it very well, what we call the midbrain. We're able to see tubercle cinecranum, mammary body, able to see posterior perforated substance, interpendicular fossa, oculomotor nerve, crus cerebri midbrain, optical tract, optic chiasma, and optic nerve. Now, posterior surface. Now, where on the posterior surface? On the posterior surface are 4 collicular, corporal, quadrigemular. These are rounded eminence that are divided into superior and inferior pairs, vertical and transverse group. Then you have the superior colli are centers with visual flexus and actually which regenerate of the tracheal nerve. Then, now, when you cut we call it horizontally when you cut the midbrain. These are some of the structures you are able to appreciate within the midbrain. You're able to appreciate the tectum, tegmentum, and serous crus cerebri. So these are some of the structure you are able to appreciate. Where we have the substantia nigra, we have the medulla longitudinal fasciculus, we have this what we call the dissection of superior cerebellar pentacles, then some structures here, nucleus that actually contains what? The nerve supply. You're able to see the trochlear nerve, cerebral adequate, pyramidal gray matter. So these are some of the structures you're able to see there. So also when you cut it across a certain level, transverse section of the midbrain, you're able to see some of the structures there. Blood supply, posterior cerebral artery, and choroidal plexus. This is the one that actually supplies the midbrain. Clinical notes: blockage of cerebral arcuate, congenital or acquired tumor led to accumulation of CSF within the third and lateral ventricles. There will be results from obstructive hydrocephalus. Now, that's the end of that one. Any question up to there?
Yes, I have a question, sir.
Yes.
On that slide that was showing how the alignment of cranial nerves has been done in the brainstem and pons, there was the first cranial nerve, which is olfactory, was missing. Is it an exception?
It is not actually, it is not arising from here. So let me tell you this, from the third one, to the 12th one are the one that actually arise from the brainstem. But the first two nerves, they don't arise from the base, but they just pass across the brainstem. Is that okay?
Yes.
Yes.
Thank you.
Now,
Thank you.
okay, welcome. Now, just a minute. Are you able to see my screen?
Yes.
Yes.
Now, class, at any point, when you are asked to tell us about the blood supply of the brain, at any point, just talk about something that you call what? Circle of Willis. Is that okay? Hello.
Yes.
Now, circle of Willis. Circle of Willis, the way you're able to see it here, we have basilar artery, we have arteries, then we have superior cerebellar artery, we have the posterior cerebellar artery, then you have these arteries that you call posterior communicating artery, meeting with middle cerebral artery, then you have internal carotid artery, and carotid artery, ophthalmic artery, we have anterior cerebellar artery and anterior communicating artery. So at any point when you are asked the blood supply of the brain, just specifically talk about the circle of Willis. Then, this is your assignment. This is your assignment. Go and draw a well-labeled diagram of circle of Willis. Go and draw a well-labeled diagram of circle of Willis and write some notes. Then I'll pick those notes on Friday. Do you have the class rep for both physiotherapy and nursing?
Yes.
So I want you to do the assignment. You collect it, then I'll pick them on Friday. Is that okay?
Yes.
Yes. So everyone to draw a circle of Willis very well. Generally, write about this blood supply of the brain. Then draw a circle of Willis, write some notes. Then I'll come and pick them on Friday. This is individual assignment. It is individual assignment, not a group assignment. Is that well understood?
Yes.
Okay. Where's the physiotherapy class rep?
I'm here.
How many are in your class?
We're 55.
55, okay. Nursing, how many are you?
127.
127. Meaning we have more than 40 students who have not joined the class. Kindly both group tell them that we are taking record of those who are attending class, and it is very, very serious. For those who are continue missing, they'll have to write a so-called letter to the dean to explain why they are not attending classes. Is that okay, class rep?
Yes.
Okay. Now, when are we meeting next time? I want to finish this week by looking at the cranial nerves, both nerves. When are we meeting, class rep?
I'll
Within
let
this,
you know.
can we do it tomorrow in the morning?
Yes.
I'll communicate.
Nursing group. Why is your meeting tomorrow in the morning?
It's flexible.
It's flexible. Okay, kindly you will share with me the link. Then tomorrow in the morning we do the class and make sure everyone attends the class, the last one. Is that okay?
Yeah.
Then let me repeat this. Go and read textbooks. Don't set on these notes. I'm going to send these notes, but I urge you guys to go and read textbooks. Is that okay?
Yes.
I'm just sharing these notes right away after this class to the person that had sent the last, the class rep that I had met yesterday. I'll forward these notes to his email. Then he'll share with you. Did you find the notes, class?
Yes.
Okay. Um,
Is the class over?
Yes, you can leave.
Okay, I've already shared the notes to the person that had sent the notes yesterday. So let him share the notes with you. Rose,
Yes.
you are the class rep.
Yes.
Yes, can you have share the notes to the gentleman? Can you ask him to share with you the notes?
Okay.
Then let's meet tomorrow in the morning. Send me the email, the link, so that you can make it tomorrow in the morning. You'll tell me the time exact. Yes, you can
Okay.
read snakes anatomy, those who are asking the snakes